Good afternoon, class. My name is Giuseppe Francioni, and I am a member of today's jury in the case between Miss Lakeisha Williams and the Ashford Hospital. After reviewing both the plaintiff and the defendant's case, I will rule in favor of Ashford Hospital. There are several key points from both the plaintiff and the defendant, which I will cover shortly. The first is that Miss Williams believes her personal information was incorrectly sent to the wrong individual in the hospital. This individual was her supervisor and co-worker. The second would be that the defendant presented several facts about HIPAA, its laws, and its policies. After careful consideration, I have made my decision to rule in favor of Miss Johnson and Ashford Hospital for a number of reasons. The first is that it's important to remember that Miss Lakeisha Williams is and was an employee and patient in this case. Upon acceptance of employment at Ashford Hospital, it's a standard for all employees to sign an agreement that its employees will not expunge personal information outside of the appropriate channels. According to the article, A Primer by Mr. Drumkey, the privacy rules also give individuals several important rights to help protect health information, or PHI. Individuals, for example, have the right to request that a covered entity restrict disclosures of their PHI, receive a copy of their PHI for inspection upon request, amend false information, and receive accountability of all disclosures of their PHI. Since Ms. Williams is an employee and patient, she would have had to sign the agreement stating that she understands the HIPAA and privacy rules. If she did not want to have her information released to her supervisor, she would have had to identify that upon signing the agreement letter. The hospital was working within its legal parameters to forward the information to care providers. If Miss Williams was worried about her information being seen by fellow employees, it was up to the individual or the plaintiff, Miss Williams, to find an alternative hospital that can provide the same service. While she believes that it's morally wrong for co-workers to see her personal information, it comes naturally with the territory, since she works in that hospital. While patients normally don't have this vast knowledge of what is actually supposed to go on, it's important to review these checks and balances of each system to maintain functionality in working hospitals. There are certain protocols that are in place to protect patients. These protocols, which are universal throughout hospitals, is the HIPAA laws. HIPAA, which stands for Health, Insurance, Portability, and Accountability, was founded in 1996 and is essentially the rules that are in place to provide privacy standards to all hospitals to protect patients' medical records. According to the article, Message to Our Nation's Healthcare Providers, HIPAA privacy rules protect privacy of patients' health information, but is balanced to ensure that appropriate uses and disclosure of information still may be used when necessary to treat a patient. Also to protect the nation's public health or for other critical purposes, such as when a provider seeks to warn or report that a person may be at risk of harm because of a patient. Ms. Williams was not considered critical or a threat to the public or even a risk to herself or other patients. This is why I will rule in favor of Miss Johnson in Ashford Hospital. I believe that both sides presented a strong argument, but when it comes down to it, providing a ruling, Miss Johnson's case stands tried and true in accordance with the rules set forth by HIPAA. I appreciate your time, and have a good night.